𝗬𝗵𝗺𝗲𝗃 Bismillahir-Rahmanir-Rahim. Honorable 𝗤𝗍𝗶 𝗃𝗍𝗄 Chairman of Aziz Fatimah Trust, Dr. 𝗖𝗲𝗵𝗺 CEO, Dr. 𝗔𝗵𝗺𝗵𝗺 Principal of Aziz Fatimah Medical and Dental College, very honorable and respected faculty, ladies and gentlemen and dear students, Assalamu alaikum. At the outset, I must admit that I wanted to start my talk today with an apology that probably I got late. Because when I received the message from Dr. 𝗖𝗲𝗵𝗺, he stated that the function would start at 11, and somehow because I had to leave Lahore and then reach here, and on the way I got a bit late. But then when we started the function, Dr. 𝗖𝗲𝗵 shared that we started it 10 minutes earlier. So even then I thought that I must say so, because I was instructed by very honorable 𝗖𝗲𝗵 that you need to deliver a talk. So this is yet another message that I wanted to actually share with you, that there is no harm in saying sorry, in owing an apology which is due, and at the same time it is also incumbent upon us to be punctual. And most of the boys and girls and ladies and gentlemen who are before me right now, most of them are young. And it is at this very juncture of life that we have to ingrain a few things in our minds. And that would definitely build the structure of your personality. Moving further, I would formally start by congratulating, first of all, the Aziz Fatimah Trust, this hospital, this college, for achieving so many laurels in such a short span of time. Indeed, your recognition at the national level means a lot. And whenever you are pitched amongst the faculty of colleges or in that committee of educational institutions related to medical education, it definitely signifies your stature in that very ladder. At the same time, it is incumbent upon me to deeply appreciate the hard work and the achievement of those boys and girls who could come to the rostrum today and receive their certificates and cash prizes. Indeed, it is a testament of their hard work, but at the same time, it shows the commitment, zeal, and knowledge of the faculty, the way they are shaping you up as the budding doctors of Pakistan. I must also very respectfully commend the parents of these doctors to be, that they have this immense satisfaction that they are parents of those young boys and girls who are winning respect and accolades for their own family. Now coming to Dr. 𝗖𝗲𝗵𝗺, and I'm really humbled by the words you spoke about me. Indeed, one obviously has to make an effort, and such effort must always be made. The result is not in your domain. The result belongs to Allah the Almighty. But what is in our domain or within our reach is the hard work, the sincerity of purpose. And I was listening very carefully to the Honorable Principal Sahab, and I would request the students that when they get time, they must once again listen to what very Honorable Principal Sahab said today. His words were actually a guideline for all of us, and particularly those who have now started treading on this path of medical profession. My association with 𝗖𝗲𝗵𝗺 is very old, quite deep, and it started in the year 2009 when I was posted in 𝗫𝗏𝗺𝗺. I was there as district coordination officer, and 𝗖𝗲𝗵𝗺 joined as the principal of Sheikh Zayed Medical College, 𝗬𝗏𝗺. And I distinctly remember the day when we met for the first time, and there was a spark in him. There was a magnetic influence that he actually carries, and it sailed me through when we were together for more than 3 years at that ferry station. And at every juncture, I was privileged to get his very wise counsel whenever there were certain issues. So my point is, that although you belong to a specific profession, but your personality must be beyond that. You must not circumscribe yourself or confine yourself to just one domain. You are a human being first, and then obviously you are a professional in your respective domain. So his wise counsel, various projects we did together, and some of you might have known or come across the name of Danish Schools. So Danish School was one of the public sector schools which was established. It was a boarding school for boys and girls, and established by the then provincial government. And it was primarily for the poor, for the orphans or for the single orphans, and how to select the students for that very school, and then how to actually bring them up when they joined. On the very first day in that school, it was December 2010, and me and Professor 𝗖𝗲𝗄𝗏 were together. We greeted them, and I must share with you, and this is I'm sharing because the lessons that you can draw from such experiences. Those boys and girls, they joined in class 6. They were from very poor background. Most of them were actually wearing जिसको हम slippers कहते हैं, and such were also in very bad shape. Most of them did not have both the parents, and few had one. And then the journey started. And that journey, when we met those students, Dr. Saeed as the principal and obviously in charge of that medical facility in 𝗬𝗏𝗺 said that I will be the custodian and looking after their health and medical issues. So proper screening of all the students was done, and since then 25 years have passed by, and mashallah, those students, they graduated, they are performing so well in various walks of life. But you people as doctors, inshallah, when you would become, my message to you would be, look beyond what you can do. You can do a lot. Do not feel yourself to be confined in the white coat alone. That white coat gives you identity as you are doctors. But at the same time, it obliterates your identity. There might be doctors from influential or wealthy background. There might be doctors with some humble background. But once you wear that white coat, you're all same. You're all similar. You are the same beacon of hope for that poor or for that sufferer or for that patient who is before you, either on a couch or on a stool, and you are there examining him or attempting to treat him. So your devotion and commitment needs to go much beyond. As I started my education, on the professional side, in a medical college, I joined the King Edward Medical College in 1990, but then afterwards joined the Civil Service of Pakistan, and the journey is still continuing. So when I reflect back and just see that I have to talk to the youth who are mashallah budding, they are bright, they are brilliant, they have joined the medical college, what can be shared with them? I thought that we should have a different sort of introspection. All of us are there as persons, and we are there as professionals too. So we are donning two caps, one as a person, as an individual, and the second as a professional. When it comes to the first cap as a person or as an individual, then most of us are here definitely Muslims, but there might be non-Muslims sitting here as well. The light comes from the deen or the religion that you profess. And in case of Islam, we see that the hukuk Allah and hukukul ibad that it talks about is something that may be a message which is reiterated today. Whenever we are in such a gathering, it at times become quite boring. I mean, similar sort of things being repeated by all the speakers. I then share with the audience that you pick any 3 points of your own choice. And if you carry that message of your own choice in such or from such events or conferences, then I think the purpose is met. And if you are able to catch few more, then probably it is the dividend or the premium. So my first dimension of talk is that as a person, how you want to carve yourself. That is your own choice. That comes from the family or the background. That comes from the environment in which you breathe. And that comes from the destiny that you have carved out for yourself. So, being a person of your own choice, and such choice, if emanates from the dictum of religion, definitely would shape our personalities far better. So this is one thing. And when we move on, there are so many examples before us whom you can try to emulate. For example, since Sayyid Sahib is here and I have immense reverence for him, at times I used to say in his absence that actually seeing him, consulting with him is like a tabarruk for me. I mean, this is my reference for him. You may or may not agree, but that is how you actually idealize a few persons. But we have so many such personalities before us. So as a person, how you would like to shape yourself to be in future is your own choice. Now coming to the other side, that is being a professional. MashaAllah, all of you have joined this medical profession. Few are at the initial stages. Most of them who are sitting in the front seats, they have crossed many places and positions, and they have risen to a level whereby they can call themselves very senior professionals. But still, all of us are professionals in our own domain. So we need to understand that domain very well. If I am a civil servant, that my domain is circumscribed. There's a limit to it. And that limit is defined by laws and rules. Being a civil servant, it is my duty to actually implement that. Someone once told me, or we were discussing, what is governance? I mean, this is a common phrase mostly used. And he summarized, that person, not me, he summarized it that governance is actually implementation and enforcement of laws and rules. A very simple definition. So whatever the law and rule is, under a society which is governed by laws and rules, under a proper system of laws, democratic way of decision making, so whatever is circumscribed, whatever is stated therein, that needs to be followed, and in order to ensure that implementation is governed. Same is true for you people. There is a scope defined for your activities. As a health professional, once you become doctor, inshallah, you would become so. And for those who are students. And once you are students, generally what used to happen, and this would have happened here as well, that white coat ceremony in the initial days when you join a medical college, there is an oath which is professed, there is an oath which is taken, and in that oath, which is probably never read later, there should be sometimes, maybe once in a year, that all of us who belong to that medical profession should have a look at it. What we had actually vowed to do Are we still adhering to that or not? Then comes, in profession, you can definitely idealize people. And there is no harm in doing that. If you idealize some, definitely you will try to emulate them. But at the same time, life is a constant learning experience. And learning does not mean that you are learning from the success of your own past or of any other person, but also from the failures. So that learning curve must go further, must go up, must go on. And if somehow you lock yourself in your own thoughts and feeling that whatever is before you or whatever you feel so is correct, then probably we are falling in a paradise which is false, which may be called a fool's paradise. So when I reflect back, sharing a few things from my past experience, when I was a student like you people, there were certain teachers whom definitely we tried to emulate. And one of those is no more alive, is Professor 𝗏𝗏𝗄𝗏 𝗏𝗏𝗄𝗏, a renowned physician. And I remember probably it was the 4th year class, and he came to teach us something about stomach. So gastric issues, gastric problems. So this was something that he was teaching us. And I still distinctly remember the way he actually maneuvered his body, like that it is esophagus which comes and gets attached to stomach, and stomach peristalsis is this. I mean, those body movements are still in my mind and impression. And that is how we started emulating those people. And second thing which Dr. Faisal Masood used to say, that if I may be a bit wrong, but as I am recalling 30 years old episode, that 90% of your diagnosis is done on the basis of history that you take. 5% probably is through clinical examination, and another 5% is only for the confirmation of your provisional diagnosis. So just coming back, so you need to actually look around and find such people whom you would like to emulate in your life, but that is not the limit. You can be higher than Professor Faisal Masood Sahab or any person whom you like to. So in that very manner, these are the steps of a ladder in order to take you up, in order to give you that very rise in your life, which inshallah is your destiny. Now once we move on, and this is a very common sort of a share and poetry verse, 𝗏𝗏𝗍 दिल के वास्ते पैदा किया इंसान को, वरना तात के लिए कुछ कम न थे क़ुर्रोबे। मैं यहाँ पे ये ज़रूर कहना चाहूँगा कि that दर्द दिल is something very important, that the Honorable Principal Sahab talked about it. These words of empathy, sympathy, compassion, care, patience, I mean, all such words are used in order to motivate the medical fraternity, because they are the one who get in touch with the suffering humanity. And in that very moment, your one word is like a soothing balm. Your such one touch at the proper point, at the proper time, would definitely change the way that person or his family or that community would think about the doctors. Still, doctors are a very highly respected profession. And it is not that it should be so, it is so because you have earned it. But at the same time, in order to protect your honor, you have to work. You have to strive. You have to actually prove yourself. I mean, this 𝗏𝗏𝗏 is before us. We are a smaller nation as compared to India, and Professor Saitab talked about that 𝗬𝗏 𝗏 but probably it was the preparedness of our armed forces, particularly Air Force, that really bamboozled the enemy. They were so in order to protect the honor of this country, they were the people at the forefront. They had to prove, and we had to stand solidly behind them as one nation. And everything was so achieved. Now, bringing that into the perspective of a hospital, whereby it is led by certain professionals, it is assisted by very able professors, and then obviously there's a team of doctors and paramedics and nurses. So you actually create an ecosystem, and in that ecosystem, everyone has to perform. And if you don't perform, then obviously things happen which bring bad name to this very sacred profession. I would like to share, when I was Secretary Health, an episode happened in one of the hospitals, I'm not going to name that, in one of the hospitals, whereby a patient, after entering the hospital, he passed away. And then there was a scuffle between the relatives of the patient and the doctors, and that emergency, it was in a way stopped. Said no work would go on. And then, in order to ascertain, I initiated an inquiry. Just a brief episode here. When the findings came, those findings showed that the doctors on duty actually changed the patient card of that very patient who had passed away. And they changed it like this, that he was received dead. Whereas it was all evident on the CCTV cameras that he came walking into the hospital. So now, a simple episode which I just shared with you, it actually shows that the character of a doctor is how very important. If you change the fact drastically like that, then it becomes very difficult for the seniors and for the administrators to defend the prestige and honor of this profession. Then at the same time, we move on, and one can say that learn from history. It's a very common phrase, you might have heard it earlier too, but there is a sense to it. History of your own choice, history of your nation, history of your profession, history of your own very life. What did you do which went well? Where did you go which probably was a wrong step? So learning from history is important, and history teaches us what the circumstances were, how were they perceived, and how the people reacted to it. So this is very important. Next thing is live in the present. We need to be very careful. The circumstances and the opportunities around you, how you are going to create a dividend out of those opportunities. The premium that you must get, you people are all very brilliant. I'm talking to the youngsters, I'm talking to the students. So this is very important, that you have to live in that very circumstances and age. And then the third thing is hope for the future. A little while ago, it was mentioned there should be no hopelessness. And that is true. Why should you be now ummid? Abhi 𝗏𝗏 फरमा रहे थे. I mean, we must have faith in our own destiny, we must have faith in our nation, we must have faith in our own country. And we have proven it very recently on the 10th of this month. We can do wonders, but obviously it depends that we have full belief in our strength, in our qualities, and we are also eager and totally in agreement to further polish and refine them. If it is not so, and simple mere hope or the word HOPE with these alphabets, there is nothing, there is no light at the end of the tunnel. Hope means planning. Hope means prudence. Hope means diligence. Hope means faith. And hope means unity. Only then one can think of a future which is hopeful. And mashallah, you people have reached to this level. You are becoming doctors, and one can definitely and very easily say that it's not an easy job now. You people have to work exceedingly well right from the time of matriculation and then OA levels or intermediate exam, MD-CAT, and so many other things. And the journey has just begun. When we talk of doctors, the professional community, mashallah, this boy is sitting here and all of you, it is just the beginning of a journey. Although you have achieved a lot many success till now, but still I tell you, it is the beginning of a journey. And we must always think that way. I mean, I have more than 25 years of service now. But every day is a new learning experience for me. But if, you have your faith and the direction very right and clear, so madad ghaibi aati. This is also my belief, and this is also my, I'm a witness to all that. कि अगर आप नेक नियति के साथ, सदके दिल के साथ मेहनत कर लें, and then leave the rest to Allah, the things would shape up in a manner that you would simply say, Allah तेरा शुक्र. और फिर आप यही आयत पढ़ेंगे, 𝗫𝗍𝗵𝗺𝗲𝗃 𝗵𝗂𝗵 कि तुम अपने रब की कौन सी नेमतों को जताओ. I mean, even your health is wealth. Health is something, a blessing. And I must also say that you need to be very careful about your health because of the changing times and the changing patterns of life. These health issues are becoming sort of health hazards, and we need to be careful. Another point before I conclude is that we are aiming towards the future. The future is digital, and just probably the very honorable Principal Sahab also mentioned it. When I say hope for the future and I said plan for the future, that does mean that you need to aim for 2030, for the world and Pakistan of 2035. What sort of challenges would be there for the medical fraternity, for the doctors, paramedics, nurses, and such structures in the times to come? Would the people, obviously the number of people would be more, but would they be coming to the hospitals that very often? Or we can devise a system of digital communication, and we talked about it, that telemedicine and many other things, they were tested during the COVID days. So my word of advice would be that you people try to be the professionals of the future. Professionals who are fully geared, who are fully equipped, and are in knowledge of what the challenges would be before you in the year 2030, 35, and then onwards. And I'm sure that under the leadership of Idris Sahab, Saeed Sahab, Principal Sahab, very honorable faculty, you would vow to prove your mettle in the times to come. This hospital has been, as just displayed on the video screen, is splendid. And Idris Sahab was just sharing with me that the daily OPD surpasses 1,500 patients per day. And they're coming up with a new venture. My all best wishes and prayers are for you. But we need to love these institutions. I mean, this beautiful auditorium where you invited me and actually bestowed this honor upon me in order to come and talk to the youngsters. These are the buildings which mean much more to a student than mere structures of brick and mortar. These become your pastime stories. These become your sweet memories. And I'm sure that with dedication, with zeal and zest, and with that hope in yourself, inshallah ta'ala, you will move further, you will rise, you will not only make your parents, a few of them are sitting here, proud, but also this nation proud. And thank you very much once again for giving me this opportunity to share my few thoughts with you people.